from Indiana, and now yield 5 minutes to our friend from Texas, Chairman Dr. Michael Burgess.
Thank you, Chairman, and I apologize for being in and out. Typical Washington morning, we've got 3 hearings in 3 different buildings. So it's taxing, but, and I apologize, Director Swagel, if you've already answered this, but the question of an internal audit of the CBO, has there one been done?
Okay, so on the financial side, you know, our spending, yes, every year. On the data security side, you know, yes, several by the agencies that provide us. The discussion we've had is focused on particular models, and that's where I would say, you know, we should be looking at areas of congressional interest and your priorities. You know, we don't have a single model, we have a collection, an archipelago of models.
Excuse me, if I could, but every federal agency under the Chief Financial Officers Act of sometime in the 1970s is required to perform a financial audit. We only recently got the Pentagon to comply with that 25-year-old law. Are you under a similar requirement at the CBO?
You know, we do one every year, and so and you know we pass every year. So actually, I don't know offhand if we're required to. We do, but we certainly do it every year.
Can I ask you to share that with my office, because I don't know that I have seen that. Let me ask you this. On your website, you talk about a panel of health advisors that holds periodic meetings, and the CBO solicits their views between meetings. But no detail is provided on the precise role of the panel in reviewing the CBO's model of healthcare policies or specific estimates. Can you cite specific, well, first off, what are the responsibilities of the panel of health advisors?
Okay. I mean, it's really they advise us that we go to them on areas of congressional interest, things that we're thinking about, and ask for their input. I can, if you will, I can give you an example. They're meeting on this Friday. And so the agenda will be on our website. Staff from the committee will be at the meeting. We have a session on technology, on new technology, a session on preventive health, the long-term effects of preventive health. And this is response really to this is your legislation. And so we're asking for input from our academic advisors. And then we have a session on vertical integration and what the impacts of that, of, you know, sort of hospitals acquiring physician practices and things like that. What does it mean for medicine and for the budget?
So is it possible to know who is on this panel of health
Oh,
advisors?
absolutely. I brought the list with me. It's on our website.
Okay.
I'll give it to you after the hearing.
So would you support codifying the panel of health advisors, providing appointment authority to the 4 corners of the budget committees and yourself, the CBO director, as well as specifying its role and responsibilities in making technical recommendations regarding CBO's models?
Yeah, so I support getting your, you know, information from you, from the committee, your colleagues, names on who we should talk to, and experts with information. And you've done that. I mean, the healthcare task force within the committee has been enormously helpful for us on, you know, say the pharma side and others. You know, the challenge with doing it with the panel is that I would hesitate to make that political. It's experts, it's non-political, and I would worry about, instead of just moving it even inadvertently toward the political side.
Well, you know, we're in a political environment. That happens. But it was difficult as the chairman or the leader of the health task force or the budget committee. It was difficult to get, I mean, thank you for that. I mean, those were good concepts. I'm glad we were able to move them along, but it was extremely difficult just to get them to a point where we could move them along, because no one really seemed to know who was doing what and who was in charge. Another thing that surfaced during all of that, I mean, the Biden administration, we're hearing a lot about it now in election season, political again, and they talk about how much money they've saved with negotiating prescription drug prices. And yet, there was concern from a number of us, are we going to reduce the number of new products that are available? The Congressional Budget Office originally came up with a pretty low number, then you revise that down to 1 new drug that wouldn't be developed because of the parameters of the Inflation Reduction Act. And yet every other expert, and we had a hearing, a roundtable about that, every other expert said no, the The number is dramatically larger, and it significantly negatively affects the ecosystem of drug development for other things as well that you wouldn't necessarily would think initially would be initially linked to the blockbuster drugs. But that's the kind of problem that we need to be able to deal with. I mean, your figures were vastly different from every other expert in the field.
No, so it's something that we've gotten feedback from, and we have adapted our modeling in response to the feedback. I can go into more detail, but in terms of the reason I think our numbers were different than the industry is that we analyzed the law, the Inflation Reduction Act, the 2022 reconciliation bill, as it was written, and the people on the outside who were analyzing it in some sense saw a slippery slope and said, look, you start here, and then it goes further. And they were analyzing, that, which is totally understandable. It's just different than what, our responsibility is.
The problem is, it's not a simple, you place those kind of restrictions, and it's not like, oh, we can develop this drug in less than a year's time. No, you can't. I mean, it's 10 years of pipeline easily. Yeah. It's 10 years and $1 billion to develop a new drug. That's the problem that I don't think the CBO was taking into account, the length of time in the pipeline for the development of these projects.
We're going to have to leave it there. I know you all have an open line of communication. Thank you for your service as chair of the Healthcare Task Force and acknowledging that that's been helpful to the entire process in your operation now.